65-year-old woman presents to the clinic for a routine checkup. She has unintentionally lost 4.5 kilos in the past month but denies any other symptoms. Her pulse is 90 per minute, respiratory rate is 18 per minute, temperature is 37 degrees Celsius, and blood pressure is 150 bar 70 millimeter of mercury. An irregular rhythm is heard on auscultation of the heart. Neck examination reveals a markedly enlarged thyroid with no lymphadenopathy or bruit. Laboratory tests show a low serum thyroid stimulating hormone level, high T4, absent TSI, and absent antithyroid peroxidase antibody. Nuclear scintigraphy demonstrates patchy uptake in the thyroid with multiple hot and cold areas. Which of the following is the most likely diagnosis? Yes, the answer is toxic multinodular goiter. This is otherwise called Plummer disease. Don't get confused with Plummer-Vinson syndrome. That is different. That has the triad of your iron deficiency anemia, your dysphagia, as well as your your webs, esophageal webs. Okay, so this is called Plummer disease, and it's very obvious just based on the fact that they're saying patchy uptake in thyroid with multiple hot and cold areas. Even apart from that, just with the presentation, okay, you know that the patient is having hyperthyroidism. Okay, the things that point towards hyperthyroidism are, firstly, she's lost weight unintentionally. Okay, anytime a patient is losing weight despite normal appetite, think of hyperthyroidism. The other thing you need to think of is diabetes. Okay, so always keep these two in mind. Okay, so she's lost weight unintentionally. Okay, her temperature is fine, all of this is fine. Her blood pressure is elevated. Okay, and but even that could just be attributed to her age. 150 bar 70 is pretty common for a 65-year-old person, so you don't have to look too much into that. But the fact that she has an irregular rhythm, okay, that's heard on auscultation, irregular rhythm, anytime you see it, automatically think of atrial fibrillation. AF is pretty commonly seen in hyperthyroidism. The only sort of beauty with respect to AF and hyperthyroidism is that if you were to treat hyperthyroidism, automatically the AF goes away. So you don't need to give any antiarrhythmic as such, okay, like you would normally in the case of a typical AF presenting as part of a cardiovascular disorder. If you treat the hyperthyroidism, it's going to go away on its own. Okay. Reveals a markedly enlarged thyroid. Okay, so you're going to have an enlarged thyroid gland, and it shows a low serum thyroid stimulating hormone. So you have a low TSH, a high T4, and you're going to have absent TSI, absent thyroid peroxidase. I already just mentioned this in the previous thing. This is for Graves and Hashimoto's. So with that itself, we can rule out option A and B. Okay, subacute granulomatous thyroiditis. Suspect this anytime they have mentioned the patient having a recent viral infection, or they would definitely have mentioned the ESR level, because ESR would be elevated, or other features like jaw pain or just something like that. Okay, but anytime they want you to know subacute, they would definitely have mentioned ESR levels. Okay. Moreover, presentation is usually just initial, transient phase of hyperthyroidism, but predominantly it's going to be hypothyroidism. Okay, so patient presenting with, features of hyperthyroidism, very, very unlikely for it to be subacute granulomatous thyroiditis. Okay, toxic adenoma. So this is pretty similar to your, toxic multinodular goiter, except in this case, it is going to be a solitary mass, it's not going to be multiple. Okay, and with that itself, since they mentioned multiple, you can just assume it's Plummer disease and go ahead with that. Moreover, just something you need to remember is anytime they mention about nuclear scintigraphy and or radioactive iodine uptake or whatever. Okay, so multiple hot and cold areas. Kind of think of the hot areas, essentially they're called hot because they're functional, meaning that they're producing the hormone. Okay, cold areas do not. Hot areas are most commonly benign, whereas cold areas are most commonly malignant. So this particular stem, it's fine since they're kind of like a mixture of both. But anytime they mention a cold area and you're having, you kind of think it might be toxic multinodular goiter, might be, malignancy. It's always good to, take a biopsy and rule it out, because like I mentioned, cold areas, most commonly they're going to be only malignant, not benign. Okay, hot areas are what are usually benign.
Thanks for watching. Please give a thumbs up and subscribe for more.